Okay, hi YouTube. It is 72 days until SRS, until my surgery. I don't really have much to update since the last time, except that Dr. McGinn's office, her admin assistant or whoever the person is, said that I am a little bit further ahead in terms of where I am with respect to all those prerequisites than I think maybe their typical patient or than most patients. So I guess it is good to know that I'm a little bit of an overachiever in that respect and kind of ahead of the curve. Because this whole time I've sort of felt like I am behind it or not going to get everything done, but it doesn't sound like that is the case, so that's good. What I am behind on, though, is losing a little bit of weight in preparation for surgery, which was not asked of me. It was something I wanted to do. But since I kind of started making these 100-day countdown videos, I've actually put on like 2 or 3 pounds. So I would like to lose that, which is why I'm about to go on a little bit of a run here, but still kind of take care of that as well. I think what I would like to spend the rest of this video talking about, though, is LGBT and T. So I am sitting on a conference here in 3 weeks called Reaching Out MBA. I'm sitting on one of the panels talking about employee resource groups, and I'm going to specifically talk about kind of that trans element of how they don't necessarily get overlooked or ignored or neglected, but there's sometimes just not a lot of experience, awareness, education around some of these issues that trans people face pretty commonly in the workplace, whether that is before you're even an employee, so like during the interview process, the application process, whatever, actual transition guidelines, non-discrimination policies, what sort of benefits you have, and then how much those benefits can even vary across employers, where some companies say you can use any surgeon you want for SRS. Mine did not. Mine said US only. Other companies include facial feminization surgery as medically necessary, because that is what the WPATH, World Psychological, whatever, transgender health, that is their recommendation or their position, I suppose. And so I'm going to talk about a lot of those things and then just talk about ERGs more in general and how my company's works and things like that. But one thing that kind of has come up in a sort of similar discussion around a different panel there is about the trans sort of being overlooked or neglected or sort of having different goals than the LGBT movement itself. And so I think that is probably substance enough for its own video, and I will probably make the next one talking only about that.